If your finger looks like a sausage, or your gums bleed every time you brush, or you have chest pain and the ER says your heart is fine, your body might be trying to warn you that you're developing an inflammatory arthritis. And here's the scary part, your doctor might completely miss it. I'm Dr. Ethan Kellum, orthopedic surgeon and one of the physicians for the Tennessee Titans and USA Basketball. And today I'm breaking down 7 dangerous symptoms of autoimmune arthritis that most people and even some doctors never connect to joint disease. These are the hidden warnings that show up months or even years before you feel anything in your joints. And if you recognize these symptoms early, you can drastically reduce the risk of long-term joint damage. Before we get into the 7 signs, you need to understand something. Autoimmune arthritis, especially the inflammatory types, isn't just a joint disease. It's a whole body disease. It can affect your eyes, your skin, gums, nails, chest, and even your internal organs. And the symptoms show up in places you never suspect. So what happens if you ignore these signs? By the time you feel the joint pain, permanent damage might already be happening. Sign number 1, your fingernails are changing. I'm talking about small dents, ridges, thickening, and the nails starting to separate from the nail bed. Most people think it's a fungal infection or they're not getting enough vitamins. But here's what's really happening. When you have inflammatory arthritis, especially a type called psoriatic arthritis, the swelling affects where your nail grows from. Nail changes often show up before joint pain. Up to 80% of people with this type of arthritis have nail problems, and for many, the nails were the first warning sign. So if you're noticing these changes on several nails, get it checked by a skin doctor or an arthritis specialist. Early treatment can stop the arthritis before it reaches your joints. Sign number 2, you can't make a tight fist anymore. You're having trouble opening jars, dropping things, can't squeeze a tennis ball like you used to. A common type of arthritis called rheumatoid arthritis almost always starts in the small joints of your hands and feet. The swelling makes it hard to fully close your fingers. And if it goes untreated, the swelling destroys the cushioning and bone in these joints. Eventually, your hand becomes permanently bent and twisted. But caught early, treatment can stop it in its tracks. So if you're struggling with grip strength, especially in the morning, get evaluated. Sign number 3, your gums bleed every time you brush. You might think it's just a dental problem, but here's the connection. The same chemicals that cause swelling in your joints also cause swelling in your gums. People with arthritis are 8 times more likely to have gum disease, and people with severe gum disease are more likely to develop arthritis. Why? The bacteria in your gums can trigger your immune system to attack your own body, including your joints. Your body fights the bacteria, but then gets confused and starts attacking healthy tissue. So if your gums are bleeding or swollen, your dentist might actually be the first person to spot that you're developing arthritis. Don't ignore this. Sign number 4, and this is a big red flag. If one of your fingers or toes swells up and looks like a sausage, you need to see a doctor immediately. This has a medical name, but here's what matters. The entire finger or toe swells from top to bottom. The joint, the tendons, and the tissue around the bone all swell together. This usually points towards psoriatic or inflammatory arthritis, and these conditions can progress quickly if ignored. I've seen people brush this off as a sprain for months. By the time they come in, we're trying to save the joint instead of protecting it. So you see this on any finger or toe, see an arthritis specialist immediately. Get imaging, get blood work. Early treatment can prevent permanent damage. If this is helping you understand what your body is trying to tell you, make sure you're following along. I break down hidden symptoms, injury prevention, and long-term joint health every single week. And the next few signs in this video are some of the easiest to miss, even for doctors. Let's keep going. Number 5, your eyes are red, painful, and sensitive to light. Most people think it's pink eye or allergies, but if it keeps coming back or if it's really painful, this could be swelling inside your eye. This isn't just surface redness, it's deep swelling inside your eye. It causes a deep, aching pain and is strongly connected to certain types of arthritis, especially ones that affect your spine and back. Up to 40% of people with this type of arthritis will develop eye problems, and if it's not treated quickly, it can affect your vision over time. So if you're having red, painful eyes that keep coming back, see an eye doctor and make sure they know if you're having any joint symptoms, even mild ones. Sign number 6, you wake up drenched in sweat and it has nothing to do with how hot your room is. When you have swelling throughout your body, it releases chemicals that mess with your temperature control. Your body thinks it's too hot and you start sweating. This is especially common with certain types of arthritis, and it's often an early sign that the swelling is affecting your whole body, not just your joints. I know night sweats are frustrating, but when you treat the underlying swelling, they usually go away. So if this is happening, especially alongside the other signs, make sure you get it checked out. Sign number 7. This one sends people to the ER thinking they're having a heart attack. Sharp chest pain when you take a deep breath. You go to the ER, they run all the tests, and they tell you your heart is fine. So what is it? It's called chondrochondritis, which is inflammation where your ribs connect to your breastbone. And yes, that's a type of arthritis. It's especially common in inflammatory arthritis. It affects the spine. The pain is sharp, it's worse with deep breaths, and often tender when you press on your chest. If your heart checks out fine, but the pain keeps happening, ask your doctor about inflammatory arthritis. This is one of those symptoms that can often be misunderstood, but it's often your body asking you to pay closer attention. Alright, so we've covered 7 dangerous signs. 1, fingernail changes. 2, can't make a tight fist. 3, bleeding gums. 4, sausage-looking fingers or toes. 5, red painful eyes. 6, night sweats. And 7, chest pain when breathing. If you have one of these signs, your body may be trying to tell you something. The worst thing you can do is ignore it. Here's what to do. Number 1, see your doctor. Ask to see a rheumatologist if needed. Number 2, get blood work to check for markers of inflammation. Number 3, consider getting imaging to check for early joint damage. And while you're waiting, support your body. Eat foods that fight inflammation and keep moving. Look, arthritis doesn't have to steal your mobility. Caught early, it's very treatable. So if anything in this video resonated with you, don't wait. Your future self will thank you. Hit the subscribe button and drop a comment. Tell me which symptoms surprised you most. I'm Dr. Ethan Kellum. Stay strong, stay healthy, and remember, the best surgery is the one you never need.